cold.
Hi, welcome in. I'm Dr. Lena. I'll be doing your back assessment today. I'll be doing some tests on your spine mobility, making sure that you're not inflamed anywhere, and taking a look to see if we could do any treatments to help your pain. All right, I'm going to start with putting your hair up just so it's out of the way for this exam. Does that feel okay for your head? Okay. I'm going to start with a gentle palpation along your spine, just to make sure that everything is doing okay. If any of this is uncomfortable, please just let me know. I am seeing a little bit of redness. Are you feeling any type of soreness anywhere?
Yeah, right there.
Right here? Okay. We'll definitely take a closer look at that with some of our tests. All right. Is there anywhere in the lower back that you're feeling tight or?
No.
Okay. Perfect. I'm going to start with just by taking some measurements of your back, just so I can get a little baseline. Perfect. All right. Just take some deep breaths for me. Perfect. Awesome. Okay. I'm not hearing anything that's too abnormal. Have you been having any troubles breathing at all? Okay. I'm going to test your reflexes on your spine. I'm just going to put my fingers here so it doesn't hurt at all. It is feeling a little bit tight here. The other side's definitely not as tight. And we'll check your shoulder blades as well. go once more down your spine just to double check everything. That's doing really well. Next, I'll be looking for some asymmetry anywhere in between your back. I'm going to grab a couple points and just lightly pinch them. It should not hurt at all. I'm going to start right here. Okay. I'm not seeing too many signs of asymmetry within your back or spine, which is really, really good. I am just going to take this and make sure that your spine is even all the way down. Your spine is very straight and very even, which is always good. I'm going to take this tool right here, and what I'm going to do with this is I'm going to measure any heat disturbances within the spine nerves. Again, this shouldn't hurt, but the endings of it might be just a little bit cold. Okay. I am going to double check this one more time just to make sure that my marks are accurate. I'm going to take this tuning fork, and what I'm going to be testing for next is any vibration imbalances. So with the marks that I have marked on your back, those are the points that I'm going to start with, and then we'll do points in between, above, and below those points as well. Do you feel that?
Yes.
Let me know when it stops.
Stop.
You don't feel that? Okay. Let me mark that down. All right. So for T1 and T2. Same thing, just let me know when you feel the vibration.
I don't feel it.
Do you feel that vibration?
Yes.
Okay. Do you also feel that vibration?
Yes.
Perfect. I'm going to do those same 2 spots. You let me know when the vibration stops.
Okay. Stop.
Perfect.
Stopped.
Awesome. All right. I'm going to be testing in between the first 2 points that we did, which will be in this area. Let me know when you feel the vibration.
I don't feel it.
Okay.
I feel it.
Oh. So I am noticing some numbness in between these 2 points right here. It stops right around here. So I'm definitely going to be doing some further testing for that area. Let's continue on to this one. So it'll be from point here to here. Let me know when you feel the vibration.
I can feel it.
Okay. Do you feel that vibration? Okay. Alright, so same as this spot up here, there's also some numbness going on right around here as well. But then after this 3rd dot down here, your sense of feeling is coming back. So I am going to go further into testing with your spinal area. More specifically, I'll be testing those spots where you had numbness and any sensitivity. My first test I'm going to start with is hot or cold. So I'll be touching you with one of 2 items, and you're just going to let me know if you feel cold or if you feel hot.
Cold. Warm. Cold. Warm. Cold. Warm. Cold. Cold. Warm. Cold. Warm. cold, warm, cold, warm.
Perfect. So with that last test that we just did, you were only really feeling some sensitivity right down in your lower back, right around this area. That's something that we're definitely going to keep in mind. The next test I have is very similar to the one that we just did, but instead of cold and warm, it'll be sharp or dull. For an example, I'll start on your shoulder. This is what dull is going to feel like. And then this is what sharp feels like. Do you feel the difference between those two?
Yes.
Okay. Perfect.
Sharp, dull, dull, sharp, 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 dull, 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 sharp, dull, sharp, dull, sharp, sharp, dull, dull, sharp, sharp, dull, sharp, sharp, dull, 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 sharp, 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 dull, sharp, 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 dull, dull, dull.
Perfect. So with this last test that's concluded, I am noticing that you are having some numbness areas right around here and right around here as well. The one that's closer to the bottom, it could just be irritation, especially from a bra strap or any swimsuits. So based on the results of our test, we definitely are going to be doing treatments today. Before we get into that, I'm going to be desensitizing your back first. If this is painful at all, it should not be. Please let me know.
Getting goosebumps.
For your treatment, we're going to start with some skin pulling. This should not hurt one bit. Just let me know. All right, I'm going to be moving along to a shoulder adjustment. So I'm going to feel around. Take this, and then you're going to take a deep breath in, and on the count of 3, breathe out. 1, 2, 3. I'm going to be using an anti-inflammatory oil. Not too much, just a little bit on your back. I'm just going to spread this first, and this is anti-inflammatory, so any muscles that are sore will go down. Okay. Just going in with another massager here. This one might be a little cold as well. Your right shoulder is very, very tense. So I want to make sure to give it some attention as well. All right, so the treatment that I just gave you was an anti-inflammatory treatment. Full effects will be felt around 24 to 48 hours after treatment once the oil is absorbed. I did notice lots of tension in this right shoulder. So within these 24 to 48 hours, just make sure that you're trying to relax and making sure not to use too many muscles in your back or in your shoulders. Did you have any questions for me? Perfect. Well, have a great rest of your day. Thank you for coming in.
I'm just gonna have you give me a big What does that taste like?
Kind of like lemon. Sharp. Good stuff. My left.
Hi, I'm Dr. Matt.
Hi.
Very nice to meet you.
Nice to meet you.
Let's go ahead and start a new file for you. Can I please have your first and last name?
Jalen Jones.
And your date of birth, please?
January 7th, 2003.
Okay. Do you have any allergies to medications?
No, I don't have any allergies. I am a little bit allergic to dairy.
Are you taking any medicine on a daily basis?
No, I take herbs, but I don't take any prescribed medication.
What kind of herbs are you taking?
I take fenugreek, spearmint tea, and sarsaparilla root.
And is this for something in particular, or you're just trying to prevent?
Yeah, spearmint helps with lowering testosterone. So I take it for that, and it helps clear my skin.
Okay. Any history of hormonal imbalances?
Yes, PCOS.
Okay. When were you diagnosed with that?
About a year and a half ago.
Okay. And when was your last gynecology exam?
I've never had one.
Okay. Were you diagnosed with PCOS by an endocrinologist?
They did it based on my blood work.
Blood work, okay. Okay. Are you experiencing any symptoms now from PCOS?
Irregular cycles.
Okay. When was your last cycle?
I got mine last week, Monday.
Okay.
Otherwise, I only get it usually once every other month.
Okay. Are you experiencing any pain at the moment?
I get a little bit of hip pain. I do a lot of yoga, but it hasn't been helping.
The hip pain, is it chronic or have you had it more than 6 months?
Yeah, it started happening after I had knee surgery.
Yeah, okay. On which knee did you have the surgery?
I had knee surgery on my left.
How long ago was that?
I had my ACL surgery in February of 2024.
Okay. And on a scale of 0 to 10, how would you rate your pain right now? 10 being the worst.
Probably around a 5. Just discomfortable. Uncomfortable.
Is it constant or does it come and go?
I would say it comes and goes mainly when sitting down or standing. If I'm laying down, it's not agitated.
Is it sharp, dull, throbbing?
I would say dull.
Okay. Are you taking any medicine for the pain sometimes?
No.
No.
I sit occasionally.
Okay. Any back pain? Any chest palpitations or difficulty breathing?
No, I get a little bit faint if I get up too quick.
Okay. Were you ever diagnosed with hypotension or hypertension? Okay. Any history of heart disease in the family?
I believe on my dad's side, he was just diagnosed with, it has to do with heart palpitations, and it mainly comes when he drinks. It's when the heart just struggles to pump blood. Something with the top chamber and the lower chamber, I believe.
Okay.
I think it starts with a P. I'm not sure.
Okay. We can definitely do a very thorough checkup to see if there are any signs of heart disease. And that's something that we can definitely do every year, every 12 months when you come in for your checkup.
Sounds good.
And we can check your blood pressure today to see if you have any variations with that. Do you wear contacts? Okay. Do you wear glasses sometimes?
I wear blue light glasses occasionally, but not prescription.
Okay. And are you experiencing any hearing problems? Any vision blurriness?
I get ringing in my ears occasionally.
On both ears or just one?
Both.
Both.
Mainly my right ear.
Okay. Any flu-like symptoms in the last 48 hours?
I've been getting stomach aches. My throat has been a little sore, but that might be from not drinking enough water.
Okay. Okay, I'm just going to have you change in our clinic robe, and then I'll take your vital signs.
Sounds good.
Okay, I'm just going to put gloves on. before we do anything, let's just go ahead and take a look in the back of your throat. Just gonna give me a big ah. Okay, there's a little bit of redness on the left side. This is just gonna go around the cheek area, so go ahead and just give me a slight ah. Okay, and a little bit in the back of the throat, just so that we can get everything. And I'm gonna send this to the lab. This is going to go on your left upper arm. I'm just going to go ahead and open this a little bit. Okay, go ahead and relax. Blood pressure is a little bit on the low side. 110/49. And that could explain the dizziness that you're experiencing when you stand up too quickly. Do you follow a special diet?
I am vegan. I'm not sure if that would affect my blood pressure.
Okay. Well, we're just going to go ahead and run some blood work. I want to test your vitamin B levels, your folate, just to see exactly what your levels are, and we'll go from there.
Would that lower my blood pressure?
It's hard to tell at the moment. We're just going to have to do more tests.
Sounds good.
Okay. Just going to check your pupils. I want to make sure that there is no devascularization behind the retina. So go ahead and look right here, straight at my nose. Good. Pupils are under-reactive to light. I'm going to have you look up for me. Good. No yellowish discoloration. Okay. Go ahead and look right here. No rhythmic changes. Okay. I'm just going to slowly palpate your nose. Let me know if you feel any kind of pain. Can you breathe in, breathe out? And again, breathe in, breathe out. Okay, tiny obstruction on the left side. I'm gonna have you close your eyes. Can you go ahead and smell this for me? Let me know what it smells like.
It kind of smells like an orange peel.
Okay. Go ahead and keep your eyes closed. It really helps to heighten the olfactory sense. I'm gonna have you take a deep breath in through your nose. And are you able to identify the smell? Okay. let's go ahead and check your taste. Just gonna have you open, close. What does that taste like?
It tastes a little bit sweeter, kind of like lemon.
Okay.
Lemon glaze.
Okay, just gonna go again. Go ahead and close and open.
I don't really taste anything.
Okay, open, close, open.
I don't taste anything on that one either.
Okay. Let's go ahead and just check your heart rate now. This is gonna go on your index finger. I'm gonna have you relax. And I'll take your temperature. This is just gonna go on the forehead. 99.1. It is a little bit elevated, but it's warm in here, so I think that could explain it. Also, your smell, your olfactory nerve seems to be a little bit damaged more on the left side. So we're just going to run some tests to see exactly where the inflammation is coming from. Heart rate is 69, great, and oxygenation is 96% on room air. Blood pressure was 110/49. I'm going to listen to your heart and lungs. Is it okay if I slide the stethoscope slightly under the shirt? Okay. So it's gonna feel a little bit cold. I can hear only S1 and S2, no S3, no S4. No signs of cardiac murmurs. Just gonna have you take a deep breath in through your nose and hold it in for 1, 2, 3. Breathe out. Yeah, I couldn't hear any murmurs, which is really good. Go ahead and check your lungs. Can you take a deep breath in through your nose and slowly exhale? Good, no crackling. Again, breathe in through your nose and breathe out. Good. Okay. All right, I'm gonna have you go on the table. We're gonna take a look at your back. I'm going to put your hair up so that I can take a look at the back. You did mention that you're having some hip pain, so this could definitely explain if we're finding something that is related to the spine. Going to open the gown in the back. going to take a look here at the cervical spine, just palpating for any signs of swelling. Slight deviation of the curvature at the junction between cervical and thoracic. No signs of scoliosis. I'm going to do a temperature variation test. This is going to help determine if there is any neurological impulses that are being shifted away from the spine. Just going to make a little mark right here. Those are the points that we know we need to assess further. Right there. Very symmetric points, which is a good indication that there is a neurological imbalance. Okay, it just stops right here. I'm going to do a few tests here. I'm going to have you tell me if you feel this sharp or dull.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull.
Go ahead and tell me if you feel this dull all the way down. Do you feel this sharp all the way down? Oh, what about now?
I felt it at the bottom.
Okay. Do you feel this the same as this?
The right side's a little less.
Does this feel the same as this?
Yep.
Does this feel the same as this?
The right side's more prominent.
And does this feel the same as this? Okay. going to listen to these points. We're looking at C4, C5. I want to see if there is any micro movement that we can detect. And you can just breathe normal. I'm going to take a few measurements here. Slight variation on the right side, about a 5 degrees angle. I'm going to have you take a deep breath in through your nose and out through your mouth. And again, breathe in and breathe out. Again, breathe in, breathe out. One more time, breathe in and exhale. Again. And last. And exhale. Slight wheezing on the right side. I'm going to have you lay down now, and we'll take a look at your scalp and face and see if there is anything that we need to address. First, I'm going to take a look at your face. We're palpating TMJ, which is the temporomandibular joint. We're looking for any type of dysfunction that can be indicated by inflammation. Sometimes a little bit of tightness can definitely be felt in this area. And I'm palpating the masseter muscles. Now, even though we do want these to be strong and CT, we definitely want to make sure that there are no nodules. Those usually constrict the circulation and they don't let the blood to flow freely. I'm not sensing any nodules. I'm going to check your lymph nodes for any swelling. Looking at the submental lymph nodes right under the chin. Palpating preauricular lymph nodes. And postauricular lymph nodes. Palpating lymph nodes right above the collarbone. I'm just gonna have you shrug your shoulders. Okay. Just gonna have you do that one more time, and can you hold them shrugged for me? Okay. Go ahead and relax. I'm going to palpate trachea. We're checking for any midline deviations. Also palpating the thyroid gland, looking for any lumps or enlargement. Go ahead and swallow for me, please. Okay. Okay, moving up to the tragus, which is the cartilaginous part of the ear, just slowly palpating to feel for any lumps. Palpating right in front of the ear. This usually tells us if there's any fluid buildup in the external ear canal. And palpating the mastoid bone right behind the ear. check for any signs of mastocytitis. Okay. Moving up to the sinuses, right in between the eyebrows, we have the first set of sinuses. I'm going to do a little test here to check for any inflammation and edema. Okay, slight fluid buildup. And then the second set of sinuses is right under your eye pockets, lateral to the nasal bridge. Okay, slight higher indentation on the left side compared with right, and I would say right side upper was a little bit more inflamed than the left. Okay. I'm gonna check your hair distribution to see if there is any signs of alopecia or hair loss. Sometimes we could see that with hormonal imbalances or vitamin deficiencies. Right towards the end of the eyebrow, there's a slight hair loss. And I'm seeing that pattern mostly on the left side. I'm going to check your hearing now. Go ahead and tell me with which ear you hear this sound.
All right. Left. Both.
Gonna check a different frequency. This is the tuning fork. It allows us to determine if there is any fluid buildup behind the tympanic membrane. Go ahead and tell me when you don't hear the sound anymore.
It stopped.
Now I'm going to put it on the mastoid bone. Same thing.
And soft. And soft. And soft.
Okay. Go ahead and tell me with which ear you hear this sound.
My right.
What about now?
My left.
And tell me now which sound you hear louder, position 1 or 2.
2.
Position 1 or 2.
1.
Okay. Go ahead and tell me with which ear you hear this sound.
My right. My left. My right. My right. My left. Both.
Okay. I'm going to check your facial reflexes. I'm just going to have you relax your jaw, slightly open. Good. Okay. Go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Sharp.
This feel the same as this.
Yeah.
Is that sharp or dull?
Sharp. 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 Dull. Dull. Sharp. 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 Dull. Sharp. Sharp.
Do you feel this all the way sharp?
Mainly on the right side.
Okay, I'm going to press a little bit harder this time. Go ahead and tell me if you feel it all the way now. Okay. Does this feel dull all the way?
Not in the middle.
Go ahead and tell me if you feel these two equally on both sides. Mainly on my right. You feel it more on the right side? Okay. I'm going to check your scalp. We're looking for any type of redness. There's a little bit of dry skin. Let's turn on the light. Okay, there's no redness, but just a slight dryness. And that could have many reasons. We're just gonna have to do some tests to check for pH level of the scalp. First, I'm going to apply a basic solution to neutralize the pH of your hair follicle. Just picking 2 spots. I'm going to distribute it evenly to make sure that the process of demineralization begins. Now we're going to be able to extract the epidermis that we need to send to the lab. You might experience just a slight irritation from the solution. It's just going to be temporary and should go in a few hours. We're collecting the sample. We want to make sure that we're attaching most of the cells that are coming from the hair follicle. We're going to send this to the lab. Next, I'm going to do a hydration test. So I'm looking to see how dry the epidermis is. I'm going to check for any sensitivity now from the solution that we just applied. Okay. Just go ahead and tell me if you feel this sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull.
Do you feel this sharp all the way to the hairline?
In the front, not in the back.
Okay, so not so much over here in the crown. Okay. Does this feel sharp or dull?
Sharp.
What about now?
Sharp.
What about now?
Dull. Dull. Dull.
Do you feel this dull all the way?
Mm-hmm.
Does this feel cold or warm?
Cold.
What about now?
Warm.
Now?
Cold. 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 Warm. Warm.
Do you feel this warm all the way up to the crown?
Mm-hmm.
And does this feel cold all the way up?
Only in the front.
No redness. Go ahead and tell me if you feel this vibration or pressure.
Pressure.
What about now?
Pressure.
What about now?
Vibration. Pressure.
What about now?
Vibration.
And now?
Vibration.
Okay, I'm just palpating both knees. Is it okay if I lift the shorts a little bit higher? Okay. Just looking for any inflammation or asymmetry. Okay, I definitely see this scar. Just slight palpation here on the left lateral. We're looking for any abnormal movement. Okay, now we're gonna check the connection between the knee capsule and the major muscles. Now I'm just going to compare with the right side. And just palpating the muscles to see if there's any tears. Okay. I'm going to check your reflexes. I'm going to have you relax your foot. Just going to bend it here from the knee up. Go ahead and relax. Good. And same thing. Relax your leg. Good. Okay, a little bit diminished on the left side. Checking your goals. Looking for any redness, warmth, or asymmetry. We definitely want to see the same size. I'm going to take some measurements here as well. Let's check your tibial reflex. Go ahead and Go ahead and bend your right knee over your left leg. Good. And relax. Good. Same thing on the other side. And relax. Okay. Checking for any edema, especially around the tibial bones. Okay, 2+. Palpating pedal pulses. 2+, strong and symmetric. I'm just going to have you wiggle your toes. Okay, go ahead and relax. I'm going to move your left toe either towards you or towards me. Go ahead and tell me what you feel, okay?
It feels towards me.
Okay.
Away. Away. Towards.
Okay. Just going to place my fingers right under your toes. I'm going to have you curl them. Okay. Now I'm just going to push. I'm going to have you pull your feet towards you as strong as you can. Good. And now push with the pads as strong as you can. Good. I'm going to put my hand under your heels. Just going to have you do the same thing. Push in. Okay, relax. I'm going to try to open your legs. Don't let me do that. Good. I'm going to try to close. Don't let me do that. Okay. I'm seeing slight difference in foot length, and we might have discovered why you're experiencing that hip pain. Okay. This is something that we would definitely have to send to a chiropractor so that they can adjust you and fix the height, because it definitely comes from the hips. We can do a little adjustment today just to give you a little boost, but I'm going to have you make an appointment with our chiropractor from the clinic, okay? Okay. I'm going to do a few tests to check for any nerve impulse dysfunction. Go ahead and tell me if you feel this pressure or vibration.
Vibration.
Okay. Same thing. Pressure or vibration?
Vibration.
Okay. Now?
Pressure.
And now?
Pressure.
Okay. Go ahead and tell me if you feel this sharp or dull.
Sharp. Sharp. Sharp.
Okay. Does this feel sharp all the way down?
At the bottom, yes.
Okay. Does this feel sharp or dull?
Sharp. Dull. 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 Dull.
Okay.
Sharp. 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 Dull. Dull. Sharp. 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 Dull. Dull.
Do you feel this dull all the way down?
Mm-hmm.
Okay. Does this feel sharp or dull?
Dull. Sharp.
Okay. Going to check for any eczema between your toes. Okay. And I'm going to check your Babinski reflex. Go ahead and just relax your foot. Great. Good. Okay, a little bit of flexing on the right side. Go ahead and tell me if you feel this puff of air on the right or left of your body.
Left. Right.
Okay. Go ahead and tell me if you feel this 1, 2, or 3 puffs of air.
2. 3. 3. 1. 2.
Okay, I'm just going to check for any asymmetry. Make sure that there is no inflammation or edema or fluid buildup. Sometimes with heart disease, we could see that in the extremities. Good. Going to do a little adjustment so that it really gives you a boost for when you go to the chiropractor. Okay. Just gonna have you take a deep breath in through your nose and out through your mouth. This is going to help to elongate the legs. Same thing. Breathe in and breathe out. I'm going to have you sit back on the table and I'm going to discuss the results. So I did see a little bit of asymmetry between your legs' length. That could definitely explain why you're having that hip pain. And the scalp area does need just a little bit of time. We're going to do some tests to see the pH and how it looks. But the good news is that I did not notice anything abnormal with your heart. So taking consideration that you have that in your family history, I think that's very important. Keep on taking your supplements and herb supplements the way you're taking them, and I think that's definitely helping with the hormonal balance that you're doing for PCOS. Just gonna have you come back and run some tests. We're gonna do some lab work for vitamin B, and we're gonna test all vitamin Bs actually, just to make sure that you don't lack that in your diet. And if you do, we're just going to supplement it. Do you have any questions for me?
Do you recommend any supplements that I should take?
I don't want to recommend any supplements if there's no deficiency. So first we're gonna find out which ones you're deficient in. If you are, if not, then that's good. And then we're going to go ahead and do a treatment plan for you.
Sounds good.
Okay. All right. Okay, Mary in the front is going to help you make that appointment with the chiropractor in our office. And do you have any questions for me?
How often do you think I should go to the chiropractor? Or will they tell me that?
Yeah, she'll definitely be able to do something to recommend based on her assessment.
Sounds good.
All right, it was very nice to meet you.
Nice to meet you too. Thank you.
You're welcome. Exhale.
Sharp, dull, vibration, warm. Good. One.
Hi, Sarah. My name is Dr. Mad. How are you doing today?
Good. How are you?
I'm good. Thanks for asking. So I have here your file. You're a transfer patient from another hospital. I'm just going to go over your medical history to make sure that I have everything before we do the exam, okay? When was your last checkup?
About a year ago.
Okay. Can you please verify your last name
Yes, Russell.
and your date of birth?
November 18th, 1998.
Okay, perfect. Do you have any allergies?
Just pollen.
Are you taking any medicine on a daily basis?
No.
Okay. Any surgeries?
No.
Okay, any recent headaches or migraines?
I've had a couple migraines in the past year.
Okay. On a scale of 0 to 10, how bad are they normally?
About a 6.
Okay, and how often do you get them?
Every maybe 5 months or so.
Do you know what they are triggered by?
I suspect stress.
Stress. Okay. Have you been under a lot of stress in the last year?
I'd say so.
Any recent changes at home or at work?
I've switched jobs twice.
Twice. Okay. Okay. Have you noticed any palpitations, difficulty breathing?
No.
Any vision changes? Okay. Any skin changes, discolorations, or eczema?
No.
Okay. And how is your sleep pattern? How long do you sleep per night?
Usually about 8 hours a night.
Okay, that's amazing.
Pretty regular.
Okay. And do you follow a normal diet? Okay. What about exercise? How often do you exercise per week?
My job's pretty active, which helps. But usually I'll go to the gym about 3 times a week.
That's amazing. Okay. Any family history of hypertension, thyroid disorders, any neurological disorders?
I think some thyroid stuff on my dad's side, but otherwise nothing.
Okay. Alright, so I'm gonna go ahead and insert this into your file since you're going to be our patient here, and we'll take your vital signs to make sure that we have a good baseline for you.
Great.
Are you experiencing any migraines at the moment?
No, not at the moment.
Okay, any pain anywhere in the body?
Some back soreness, but that's all.
Okay. On a scale of 0 to 10, how would you rate the back pain?
Probably a 2.
A 2. And is that constant or it comes and goes?
Comes and goes.
Okay. So this is going to go under your tongue. I'm just going to have you hold it for me.
Thank you.
And then this will go on your index finger. It's going to measure your oxygenation and your heart rate. And 98 to 76. Perfect. Perfect. Okay, so that is 98.6 Fahrenheit. That's very normal. And now I'm going to take your blood pressure. Is your left arm okay? So this is going to go on your upper arm. And you said there is no hypertension in the family. You're not feeling any palpitations, no headaches at the moment either. So I'm gonna have you relax your arm, uncross your legs. Perfect. Just going to place this here. Okay, this is going to go right here. Okay, I'm gonna have you relax. Blood pressure is 116/75. Okay, I'm just going to slide this down. And how tall are you?
5'4".
Perfect. I'm going to listen to your heart. So I'm just going to have you scooch a little bit closer. That's perfect. Okay, go ahead and relax. I can hear only S1 and S2, no S3, no S4. Going to listen with the bell. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay. I'm going to listen to your lungs in the front, and then I'm going to listen to the back too. Go ahead and take a deep breath in and exhale. Breathe in. Exhale. Breathe in. Exhale. Is it it okay if I listen to the back? Okay, I'm gonna have you turn around towards the wall. Perfect. Go ahead and take a deep breath in and exhale. And again, breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, exhale. Breathe in, breathe out. Where is the pain located? On the back? The back pain. Can you go ahead and point it?
Oh, down here.
Lower. Or lower. Okay. And does it get worse when you're standing or sitting?
Standing.
Standing. How is the pain right now?
Right now it's fine.
Okay. I'm looking for signs of scoliosis or lordosis, which is a deviation of the spine, normal angle, and it could indicate that the vertebrae are moving, shifting in the wrong direction, and that could cause strain on the muscles around, nerve pain associated with it. I'm going to do a sharp or dull test. Go ahead and tell me if you feel this sharp or dull.
Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Does this feel the same as this?
Yes.
Does this feel the same as this?
No.
Does this feel the same as this? Okay. Go ahead and tell me if you feel this pressure or vibration.
Pressure. Vibration. 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 Pressure. Pressure.
And does this feel cold or warm?
Warm.
What about now?
Warm.
And now?
Cold.
And now?
Warm. Warm. Cold. Warm. Cold. Warm. Warm. Cold. Cold. Warm. Cold. Cold. Warm. Warm. warm, cold, cold, warm, warm.
Okay. So I'm gonna have you change into our gown, and we're gonna go ahead and do a head exam first, and we'll move down. Going to put gloves on. I'm going to start by palpating your face. Let me know if you feel any kind of pain. Palpating masseter muscles to check for any inflammation. Checking lymph nodes. Checking preauricular lymph nodes for any inflammation. Post-auricular lymph nodes. Also, we're checking thyroid gland to make sure that there is no nodules. Both wings are non-palpable. Trachea is midline. Palpating mastoid bone, which is the bone right behind your ears. Checking to see if there is any signs of mastoiditis, an inflammation of the bone that sometimes could be discovered through just regular palpation. Going to palpate your sinuses right in between your eyebrows. Sometimes we could notice a little bit of swelling, tenderness, redness. And right under your eyes. Just going to slowly palpate around the fossa, the orbital part is definitely very sensitive. Okay. Palpating the hairline to see if there are any nodules, asymmetries. I'm going to take a look at the scalp to see if there is any inflammation, if you're suffering from any disorders of the skin that may be a little bit difficult to assess. looking at the hairline, I'm noticing a little bit of flakiness, dandruff. So you might be having a combination of oily and dryness. But I'm not seeing any redness, so that's good. Okay. I would really like to take a sample and see if there is any fungi or bacteria that we are dealing with. So what I'm going to do is I'll apply a toner that helps to balance the pH, and then we're going to take a sample and send it to the lab. Okay. So we want to scratch off as many dermal cells as possible. This also helps to regulate the pH of the hair follicle. This is going to feel a little bit wet. Okay. So now we're trying to see if there is any redness that appears after the treatment. Okay. Normal coloration, normal hair distribution, no signs of alopecia. Okay, this is going to help to soothe any inflammation from the test that we did, just so that we balance the pH and allow for healing. Going to check your hearing. Go ahead and tell me if you feel this on the left or right.
Left. Right.
Okay. Go ahead and tell me when you don't hear the vibration anymore.
I don't hear it.
Okay, go ahead and tell me when you don't feel the vibration anymore.
No. I don't feel it.
Okay.
Stop.
Okay, go ahead and tell me which position here is louder. Position 1 or 2.
2.
1 or 2.
1.
Okay, so on the right side, there's definitely a little bit of imbalance. I'm gonna go ahead and examine your abdomen. Okay, Sarah, I'm just going to go ahead and take a look at your abdomen. First, I'm going to listen with a stethoscope. This is going to feel a little bit cold. Normal abdominal sounds. Have you noticed any swelling, any pain?
No.
Okay. I'm going to go ahead and percuss. Just a gentle palpation to check for any organ enlargement. So we're checking all 4 quadrants. Here we have the liver that usually is encapsulated under the ribs. go ahead and close this. I'm going to take a look at your legs. Just gonna go ahead and just palpate to see if there is any edema. Okay, no more normal temperature. Going to check pedal pulses. 2 plus, strong and symmetric. I'm going to check neurological response. Go ahead and tell me if you feel this vibration or pressure.
Pressure. Vibration. Vibration. Pressure. Pressure.
Does this feel cold or warm?
Warm. Cold. Cold. Warm.
Do you feel this pressure or vibration?
Vibration. Pressure. Vibration. Pressure.
I'm going to check your reflexes. I'm going to have you relax your leg. Just relax. Good. Good. Relax. Okay, a little bit diminished on the left side. I'm gonna have you relax and just twist this. Perfect. Good. Same thing on the other side. Okay, very good. Go ahead and relax. Going to check your Babinski reflex. Good. Let me do that one more time. Okay, very good. Just looking in between your toes to see if there is any eczema, dryness. Maybe we can recommend like a special cream that can help with that, especially when you stand up for a longer period of time. It could affect our feet as well. I'm going to move your big toe either towards you or towards me. Go ahead and let me know which position you feel.
Towards me. Towards you. Towards me. Towards me.
Okay. Go ahead and wrap your toes around my fingers. Okay. I'm gonna push towards you. Don't let me do that. Okay, I'm going to push them away. Don't let me do that. I'm gonna try to open them. Don't let me do that. I'm gonna try to close them. Don't let me do that. Okay, good motor strength there. I would say 4 out of 5. That's perfect. Okay, I know I already palpated your back, so I'm going to go ahead and listen for any abnormal sounds. You can go ahead and just breathe normal and relax. Hearing a little bit of crackles at the base of the lungs. But only on the right side. I'm not sensing any inflammation around the spine. It is normal size. I'm going to check hydration status. Go ahead and tell me if you feel this 2 or 1 pressure points.
1, 2, 1, 1, 2, 2, 1, 1, 2, 1, 2, 2, 1, 1, 1, 2. Okay. The same thing. Go ahead and tell me if you feel this 2 or 1. 1, 1, 2, 1, 2, 1, 1, 2, 2, 1, 1, 1, 2, 1, 1, 2, 1, 2, 1, 2, 2, 1, 1, 2, 1, 1.
Take some measurements to check for asymmetry. About a 2-degree difference, which is not indicative of inflammation in the back area. I'm going to go ahead and run a few more tests, and we're going to take some x-ray of the back just so that we rule out any scoliosis or lordosis of the back spine. Okay, something that could definitely explain your back pain and also the migraines. So I'm going to have you get dressed and we're going to discuss the results. I'm going to take off my gloves and I want to do a one quick exam. So check your vision and your pupil response. There you go. Okay, so I'm going to have you look right here. Okay, I apologize for the light. Go ahead and look up for me. Okay. I'm not noticing any yellowish discoloration. Okay, eyes are symmetric. Go ahead and look right here. Look right here. Okay, how many fingers am I holding? 2. Go ahead and cover one eye. How many fingers am I holding now? 2. Okay, go ahead and cover your other eye. How many fingers am I holding now? 2. And now? 1. Okay, very good. Okay. So, Miss Russell, everything looks good. I think the migraines might be from a lack of caffeine, so I do recommend that you start a low dose of caffeine. That will help to stimulate your nervous system, and take it only as needed, so it doesn't have to be on a regular basis, just probably when you feel like you get a new migraine. Okay? And then we're going to run some x-ray of your back just to check for any scoliosis or lordosis, something that could definitely either trigger the migraines and the back pain. But otherwise, everything looks good. And I'm hoping that the x-ray will reveal what we're looking for.
Sounds good. Thank you.
You're welcome. Just gonna go ahead and write this down. So, do you have any questions for me?
No, I don't think so.
Okay.
Sounds good.
Thank you so much for coming in. I'll see you soon, okay?
Yes.